Yes. Next thing we're going to talk about is pursed lip breathing and how to address chronic hyperventilation. Most patients or athletes actually breathe too much. They hyperventilate. And it looks something like this. Now, to most people looking at that, it's, oh, there's nothing wrong with that. Well, the problem is your lungs should be able to expand and take in as much oxygen as it possibly can, or air it possibly can, in 2 seconds. But it takes 8 seconds to go ahead and exhale. The reason it takes 8 seconds, you need that kind of time to go ahead and actually extract the oxygen from the air that you have just inhaled into your lungs. Okay, so the way you go ahead and train for that, you can train doing it standing, seated, or supine. In other words, face up. And we're going to start with just supine, face up. So it's going to be 2 seconds in, 8 seconds out. That means 10 seconds total. So if you do 6 sets, that's a 1 minute respiration cycle, which is pretty good. All right, and it will look something like this. Now, if you remember the video for the high-low test, notice I put my hands on my chest and on my stomach to go ahead and again monitor and make sure that I'm expanding my lungs properly. Okay? The next thing is, if you were paying attention, I was not holding my breath. A lot of patients or athletes, when they actually perform the pursed lip breathing, they're actually trying to hold the breath to go ahead and get the proper amount of time. If you heard, you could audibly hear me exhaling and pushing the air out, and I had plenty of air left. And that just takes a few weeks to go ahead and kind of get that kind of pattern going, and then automatically it becomes normal.